Today, we're joined by Todd Anderson, HPLC Product Specialist, and Weston Umstead, Technology and Business Development Manager. And with that, I'll hand it off to them.
Hello, everyone. I want to thank you for joining us today for our presentation today of Chiral SFC method development on polysaccharide-based chiral stationary phases. Today, I am very happy to have Dr. Weston Umstead from Chiral Technologies with us. Wes is actually a graduate of the University of Denver in 2016. After that, he came to Chiral Technologies as the business development manager. He later then started working on a PCR cleanup product called Rapid Tips, and then transitioned into a technology manager role in 2019, heading the group responsible for all analytical and preparative chiral method development activities. In 2010, Wes also added the business development role, where he is now also in charge of all in-house and outsourced custom separation service projects. Mixed in with these other roles, he has been focused on outreach and collaboration with folks in academia and industry to develop and promote the usefulness of chiral separations. And it's pretty much what brings him here with us today. So with that, I'm going to go ahead and turn it over to Wes. Glad to have you here. Go ahead and take on with your presentation, and then I'll join you in the middle.
Thank you, Todd, for the introduction. As you are all very much well aware at this point, you are here to learn a little bit about chiral SFC method development on polysaccharide-based chiral stationary phases. As a little overview for the topics that we're going to be touching on today, I usually like to start these presentations off with an introduction to chiral chromatography, just so that we're all on the same page when it comes to nomenclature and background, and then really discuss a little bit about the separations mechanism to help explain why we have so many columns. A lot of the time will be spent obviously on method development, strategies for chiral SFC. And then at the end, we'll finish up with some column care topics that are particularly important for SFC, especially as you get into prep. So for a little bit of background and just sort of, again, making sure we're all on the same page, we're going to be dealing with polysaccharide-based chiral stationary phases today. And for the purposes of this discussion, all of the Daicel naming goes something like chiral pack is all coated amylose-based polysaccharide columns, as well as all of the immobilized columns, regardless of the polysaccharide source. And then chiral cell is for all coated cellulose-based columns. So the first generation, we call them the coated columns, are applicable for normal phase, polar organic mode, and reverse phase, in addition to SFC, and they are everything from AD to OZ. Now for the amylose-based columns, that would be all the things that start with A, and all of the cellulose-based columns for coated start with O. And then you've got the second generation immobilized columns, which are easier. They all start with I. And they are compatible with all of the same mobile phases, as well as some of the forbidden normal phase solvents like dichloromethane and ethyl acetate, which I will cover in a few slides from now as to why that's the case. But we have everything now from IA to IK. Now in total, we've got 44 chiral stationary phases. Some of those are shown over to the middle and right-hand side of the slide here. 36 unique selectors. The difference comes from the fact that there are 8 that are available as both coated and immobilized columns. For instance, chiral pack IA and AD are the same selector. They're both 3,5-dimethyl phenylcarbamate. And in some cases, you've got a choice between amylose and cellulose. So for instance, IA and IBN, which are at the very top of the slide here, are both 3,5-dimethyl phenylcarbamate, but IA is on amylose and IB or IBN is on cellulose, which does give rise to some very interesting changes to chromatography, as we'll talk here in a few slides about. Making these polysaccharide-based chiral stationary phases is fairly straightforward. You can take an unmodified cellulose polymer or amylose polymer, react it with a functionalized isocyanate like this 3,5-dimethyl phenyl isocyanate, react all those terminal hydroxyl groups, and get a functionalized cellulose polymer. Now, that polymer is still soluble in strong organic solvent like dichloromethane and THF. So if you dissolve that polymer up, mix it in with the silica gel size of your choice, You effectively coat that silica gel, dry it down, and form your coated chiral stationary phase. Now, because these polymers are soluble in strong solvent like DCM and THF, ethyl acetate, that means that this polymer can be removed easily from the surface of this silica gel. So that's partially why the coated columns are not compatible with these solvents, but immobilized columns are. In any case, if you take it through this process for the coated polysaccharides, you end up with the first generation coated phases I showed before, AD through OZ. But instead of just coating and drying down, you institute also an immobilization procedure. That immobilization procedure cross-links the polymer with itself, as well as binding it to the surface of the silica. That polymer is now no longer able to be solubilized from the silica gel. And so these immobilized columns are now compatible with things like dichloromethane and ethyl acetate and THF, which expands the possibility of finding a chiral separation when you're doing a screening. So take that procedure and apply it to this tris-3,5 dimethyl phenyl carbamate cellulose polymer, and you'll form the immobilized version of OD, which is IBN or IB. Do that for all of the other selectors that we have offered, and you've got IA through IK now, the immobilized series of columns. Now it's easy to sort of represent this polymer as a linear structure. Chiral cell OC, as shown on this slide, tris phenyl carbamate on cellulose, but in reality it forms a left-handed helical structure, which is what I have shown here. In doing that, it forms these little pockets along the outside edge of the polymer core, which we like to call chiral grooves. And within the chiral groove, you'll see the chiral selectors start to form in all sorts of different orientations, this network of interactions that can take place with the chiral analyte as it's passing through. And then this is going to look very different for every chiral stationary phase, the orientation of the selectors, as well as the size and shape of the chiral grooves. Now, within the chiral grooves themselves, there are a number of intermolecular interactions that can take place that are well documented. The four that I have shown here are the ones that tend to occur most frequently: hydrogen bonding, steric hindrance, pi-pi interaction, and dipole-dipole interactions. And we want some combination of these interactions to take place. We want at least 3, but in reality, there's a lot more than that that take place. This Easton-Stedman model sort of shows what that looks like. So you've got a drug binding site, which you can imagine in our case would be the chiral selector site, which has certain features to it, A, B, C, which can interact with a set of enantiomers that are incoming. That might be hydrogen bonding, it could be pi-pi stacking, and it could be dipole-dipole interactions. Now you've got your pair of enantiomers. Your active enantiomer in this case is going to be the enantiomer that's more strongly retained. The inactive enantiomer is the one that's going to be eluted first. So the active enantiomer also then has functional groups that can line up and form some sort of interaction, intermolecular interaction with the chiral selector site. And that energy difference then results in a chiral separation. By definition, the inactive enantiomer has the same functional groups, but lined up differently in terms of the orientation around that chiral center. And so it doesn't match up the same as the active enantiomer did. Like I said, an energy difference then exists. And if the energy difference is enough, you will see a chiral separation of these two compounds on that particular column. Even if you take that inactive enantiomer and rotate it, there's still not the same sort of energetic matchup as there was in the active enantiomer case, and so enough of a difference to see a separation. Now, in reality, the situation's a little bit more complicated because you have to take into consideration your analyte and your chiral selectors are all solvated by the mobile phase. So at the top here, you've got your chiral selector, you've got your analytes that are also solvated. And when there is an interaction in, say, an ideal fit where the active enantiomer is lined up perfectly with the chiral selector, you'll see some exclusion of the solvent. And in the non-ideal fit case or the inactive enantiomer case, perhaps there are still some functional groups that are solvated, and therefore, even though there may be some flexibility within the compound to sort of accommodate the positioning or the structure of the chiral selector, it is not able to interact as strongly. And again, you see an energy difference and a chiral separation. This is in part why, if you've ever done normal phase or even SFC and you've changed modifiers, or you've gone from hexane IPA to hexane ethanol, you might end up losing a separation. And it's likely because there are some uh, functional groups that are either protected or solvated by the mobile phase differently than you would have in the case where you saw separation. Now, like I said, there are some variations available where you've got both cellulose and amylose-based 3,5-dimethylphenyl carbamate. The difference between cellulose and amylose is arising from the linkage of the glucose monomers. In the case of in the case of cellulose, you've got beta linkages. In the case of amylose, you've got alpha linkages, which then results in quite a dramatic difference in terms of the shape and size of the chiral grooves and the overall appearance of the helix that forms of that polymer. So on the left-hand side is chiral cell OC, which I showed previously. On the right is sort of the theoretical chiral pack AC. That's not a commercial phase, but if it were to be given a name. And you can see again, there are chiral grooves that are here, but the overall size and shape and orientation of the chiral selectors is very different. So it's not that much of a stretch to imagine these two phases should behave differently when trying to analyze the same pair of enantiomers. As a practical example of that, here's the separation of prilocaine on normal phase, hexane IPA, and it's a basic molecule, so there's 0.1% DEA in here to help with peak shape. You've got a number of interactions that can take place between it and the chiral stationary phase. So if you look at the separation on chiral pack IA, which is that 3,5-dimethylphenyl carbamate, you see just barely a hint of separation. If you change the polymer from amylose to cellulose, which is IB or IBN, you see nearly baseline resolution of the same compound with the same mobile phase. And if you change the electronics of the chiral selector from 3,5-dimethyl to 3,5-dichloro, which is chiral pack IC, you now have a nice baseline resolution. Again, no changing of the mobile phase and no changing of the analyte, only changing the chemistry of the column. So it makes it very complicated to take a starting material and predict what conditions are going to work well. So generally speaking, the best place to start is a method development screening. If we look here at separation of phenyramine on the library of immobilized columns, IA through IK, again, this is under normal phase conditions, but this would be applicable for SFC as well. You've got a couple of separations where there's hints, but then IK provides you with almost baseline resolution from this initial screening. So on to method development. Now, unlike achiral method development, which you might be familiar with, where the primary separation mechanism is polarity, that is the difference in polarity between the analyte and the stationary phase, chiral separations are governed by a lot more complicated and not as easily predicted interactions. On achiral stationary phases, if you have a simple enough model, you can even make a pretty educated guess as to what the elution order should be. So if you were to perform a separation on, say, a nonpolar C18 column with this mix of 4 analytes, phenethanol, parafluorophenethanol, anisole, and toluene, it's expected that toluene, which is the more nonpolar component of this mixture, would be more strongly retained relative to the polar components like phenethanol and parafluorophenethanol. And even if you take the mobile phase and you mix it up from methanol water to acetonitrile water, often you can find separation conditions that at least provide you with the same elution order, if not close to or identical elution time. That's not the case for chiral stationary phases or for chiral separations. As I already pointed out, when it comes to solvation of the selector and the analytes, changing from ethanol to methanol or other changes can have a pretty dramatic effect and result in a complete loss of separation or a dramatic improvement in separation. So the best approach to start is to do a method development screening. This is sort of a cartoonish version of what that would look like if you've got a system that is equipped with a 12-column switching valve. You can have a series of modifiers, say methanol, ethanol, and isopropanol, screening across these 12 columns using UV detection, mass detection, whatever is required for your application, and very quickly in an automated fashion overnight screen these 12 columns across these mobile phase conditions and get a potential hit for optimization. Now our screening setup looks something like this, where we go through all of the immobilized columns, IA through IK. We do still, especially for preparative applications, include some of the higher performing coded columns, AD, OD, OJ, and AS. And if we don't find any separation on this primary screening, which doesn't happen too often, we can also mix in some of the remaining coded columns, AY, AZ, OX, and OZ, as well as some of the specialty columns, which we're not going to talk about today. They are chiral columns, but they are not polysaccharide based, so they are somewhat application dependent, but something like Zwix, which is designed for zwitterionic and amphoteric molecules, oftentimes works well under SFC mode and can be tried if you don't find a separation on these screening conditions. Now the mobile phases, I have them listed here as normal phase. In effect, CO2 alcohol acetonitrile is the same as normal phase. LC, which would be hexane alcohol. So the naming hopefully doesn't throw you too much. So normal phase, we're talking about CO2 alcohol in this case, methanol, ethanol, or isopropanol, and then CO2 acetonitrile. I have here listed 80-20 and 70-30 respectively for alcohol and acetonitrile. In reality, what we do is we pick a single column, say it's Chiral Pack IBN, and make a single injection with that column, say with 80-20 methanol, and see what the retention looks like for the particular analyte that we're interested in screening. If we find that there is not very good retention, we can, of course, decrease the amount of methanol or whatever the modifier is. If we're finding that the compound is coming off the column too quickly, we can make those adjustments before we commit to an entire screening. And of course, if the retention's too long, same thing, we can increase the amount of alcohol and make sure that we're not spending too much time doing our screening. So make that single injection, do that retention check, and then make the adjustment as need be. For the coded phases as well as the immobilized columns, it's the same basic starting conditions. Additionally, for the immobilized columns, because they are resistant to some of those harsher organic solvents, we have what we'd call the extended range mobile phases, where you can do DCM, THF, or methyl tertiary butyl ether with CO2. Now, with those solvents, they do, under SFC mode, tend to result in high retention. So oftentimes we find that you need to add 20% methanol to help with peak shape and help move things off the column a little bit faster than they would without it. So again, that's one of those things that you might need to play with when you do retention checks, but these combinations often work well, especially with things that are not very soluble in alcohol alone. Here's just sort of a very basic sort of SFC output from screening for methocarbamol, where you've got a couple of different mobile phases that separate it fairly well. At the top here, you've got Chiral Pack IA with 25% THF. In the middle, Chiral Pack IB with 20% isopropanol. And at the bottom here, Chiral Pack IC with that mixture of methyl tertiary butyl ether with methanol at 25%. Nice baseline resolutions, more or less across the board, except for IA, but certainly room there for optimization for IA. And as another example, Devronol, same thing, IA down to IC at the bottom, methanol, acetonitrile, methanol, methyl tertiary butyl ether in the middle, and then methanol DCM at the bottom here on Chiral Pack IC. Now, as I showed in that model where the selector, chiral selector, and the analytes were solvated, the modifier effects under SFC conditions are the same as they would be under LC conditions, whereby if you change the modifier, it's not unexpected to see some dramatic changes, including reversal of elution order. This is a separation of a proprietary compound on ODH, going from methanol to acetonitrile. Obviously, there is a change in the selectivity as a result of changing the mobile phase, but again, it's not uncommon, I should say, to see a potential reversal of elution order, which is not always apparent. So if you've got a way to detect that, that's always a good thing. Say a CD detector, for instance, or if you've got standards, it's a good thing to check. You might find something very interesting, such as the case for the separation of catechin on SFC. On the left-hand side of the table here, we've got conditions for Chiral Pack IF, and then on the right-hand side, the separation conditions for IH. In this case, IF elutes the minus enantiomer first, and IH reverses it and puts the positive enantiomer first. You see the overlay here. Not Again, it happens sometimes. It doesn't happen all the time. This is changing column chemistry, and it results in a reversal of elution order. But again, as an example, even the same column changing mobile phase can have a dramatic effect on the elution order. This was a DDT analog, which separated well on chiral cell OJ. At the top here, under 100% methanol conditions, you can see based on CD detection, the positive enantiomer was eluting first and the minus enantiomer was eluting second. And as we were doing the optimization process and adding in a little bit of ethanol down to the point where we were switching to 100% ethanol, you're actually seeing a reversal of elution order here, where basically the positive enantiomer is not moving all that much, but the minus enantiomer ends up eluting much earlier under ethanol conditions than it did with methanol conditions. It's a nice handle to have when you're doing method optimization. For instance, if you are doing prep, you want to make sure that your target enantiomer is coming out first because you can achieve higher purity. If you were doing analytical, you'd want your impurity to elute first. That way you could get a higher LOD, higher LOQ without having to worry about the large API or the larger peak tailing into that smaller impurity. So again, it's an interesting handle to have control over. Now, where do you begin though? I showed you some of the screening results, but where do you begin in terms of optimizing things or trying to get a baseline resolution? Well, the easiest parameters often to check are mobile phase composition, temperature, and column length. So as an example here, lenalidomide separates well under SFC mode with Chiral Pack IBN. At the bottom here, 8515 CO2 methanol, very long retention time. It's a 24, 25-minute method, and certainly well resolved enough that you could increase the elution to save a little bit of time. So if we add 10% methanol, everything comes off in less than 7 minutes and still more or less baseline resolved. And by extension, adding in more methanol is only going to push it off the column faster, to the point where 50% methanol, obviously you lose the separation altogether. So in effect, adding more modifier is going to decrease the retention, decrease the analysis time, and of course, removing modifier will increase retention and increase analysis time. But depending upon what the effect is, you kind of have to go through the optimization process to figure that out. Whatever it is that you choose to do, especially as you start to move into changes to mobile phase composition and temperature, you want to make sure that you're using what we call a central composite design, where say you did the initial screening at 50-50 methanol ethanol at 25 degrees C. You'd want to make sure that you were choosing points that only changed one variable at a time, as opposed to changing multiple variables at the same time. It makes it a lot easier to track what changes are having an effect on the column, on the separation. So for instance, here you'd go to 15, 75, 25 and track these corner points. And then even in an expanded version, what you'd have is another 4 diamond points where the initial screening was at 25 degrees. You'd keep it at 50-50, but just increase the temperature or just decrease the temperature. Or you'd keep it at 25 degrees and you'd go to 25-75, or you'd go to 75-25. Helps you better track what changes are having an effect on the chromatography, as opposed to the random walk approach, where you're just sort of randomly picking parameters out of the air and changing multiple things at the same time. B prime, for instance, might provide you with a very nice separation, but B prime, if you were to decrease, say, the mobile phase concentration from 90% methanol to 85% methanol, you might lose the separation. Or if you decrease the temperature slightly from 40 degrees to 35, you might lose the separation. That might indicate a loss of separation, that a column is bad, but without this random by performing this random walk, you wouldn't necessarily know that. If you were using a systematic approach, you might be able to tell that that 5-degree change in temperature actually results in a loss of separation, and it's not a column issue, that it's a method issue. As an example of that, this is separation of cannabichromene and cannabicyclol on, I think this was Chiral Pack IBN. The point here illustrated, though, is that variable temperature doesn't really have much of an effect on the separation. This separation here was done under 96% hexane, 4% ethanol, mobile phase, going from 15 degrees at the bottom here to 35 degrees. You do see a slight improvement in terms of the retention when you go to these lower temperatures, which is to be expected. As a note, under chromatographic conditions, generally speaking, higher temperature results in a shorter retention time and sharper peaks, but because of that shorter retention time, you might actually lose selectivity. Lower temperature increases retention, but it also ends up resulting usually in wider peaks. And so again, you might lose that separation, you might lose that selectivity. So it's one of those method parameters that you have to optimize. In this case, temperature really didn't have much of an effect whatsoever. However, mobile phase composition does, going from 95% hexane at the bottom here up to 99% hexane. There's a critical point here that you pass from 97% to 98% where you lose the separation altogether. So if you just sort of randomly picked 97.3 as conditions that worked well for your separation, and it works, but you were letting your instrument do the mixing, and for whatever reason your binary pump or your quaternary pump was not actually pumping 3% ethanol, it slips down to 2%, and you saw this, you might again think there was an issue with the column, when in reality it's a method robustness issue, it's not a column issue. Mobile phase additives are extremely important for all chiral chromatography, as it is in chromatography in general. The nice thing about SFC for acidic analytes is that you don't need any sort of an additive. So you can run CO2 methanol, CO2 ethanol, and not have to worry about, say, formic acid or trifluoroacetic acid. But basic analytes definitely need an additive. Something like dimethylethylamine, DMEA, is an interesting one to use, especially for prep applications. It is extremely volatile, and so it helps, especially with recovery and contamination. It's easily removed when you're doing the prep separations. And then things like linear or cyclic amines, cyclohexylamine as an example, tend to work really well, although they are a little bit heavier and not as volatile. So you kind of have to take those into consideration. Because you're only able to add this additive to the modifier, generally you have to add 0.2% by volume as opposed to 0.1% as you would under LC conditions, but that's not really a disadvantage. Whatever it is that you choose to add, you can go up to 0.5%, but exceeding 0.5% can have a negative effect on column life. Without an additive, separations that should look good, like the separation of chlorpheniramine on ADH, will not look so good. As an example here on the left-hand side, one long tailing shark fin sort of peak. So you've done the method development screening, and screening ultimately provides you the best opportunity to find the separation conditions. Changes in phase have the greatest effect on selectivity, so changing CSP, changing mobile phase. Where do you go from here, though, when you want to start developing a preparative separation? Well, oftentimes what we try to do is limit mobile phases because we want to make sure that we're creating a method or finding a method that has good solubility for our analyte. Solubility is one of the largest killers in terms of productivity when it comes to scaling up to prep. It's a little trickier for SFC because in SFC, you can only check your solubility in your modifier. So you can only check it obviously in methanol, not CO2 methanol. But this is where the addition of dichloromethane oftentimes is helpful for SFC. This is only applicable for immobilized CSPs because, again, DCM is not compatible with coated columns. But if your solubility is suffering, that mixture of DCM methanol oftentimes is a nice workaround for bumping up the solubility to end up with a more productive SFC separation. And when you're doing this screening, at least our approach is we do the screening on 5 micron CSP. and 4.6 by 250 millimeter length columns. We choose 5 micron because it's the smallest particle size for prep separations. It is, generally speaking, the most often used particle size for SFC, although 10 micron can also be used. It's the one that gives you the best resolution for preparative scale. And then we use 4.6 by 250 because it makes for easier transferability, and there'll be more on that to come. So let's look at a preparative screening. This is normal phase conditions, but again, imagine this is CO2 ethanol instead of hexane ethanol. The result would be the same, and the approach would be the same. You've got a separation here on a number of different columns. The question, of course, would be what column should I then pick to move forward into optimization for a preparative separation? And really, it ends up coming down to trade-offs. Trade-off between selectivity and cycle time, because we're not going to be making just single injections when we do prep scale. We're going to be doing stacked injections, which I'll have a representative diagram on in a few slides. So it's not always about the best separation. You want to maximize the amount of material going through the column at any given time. So in this case, while the separation in red, which is 100% acetonitrile, certainly gives you the best selectivity, the one in green gives you an okay selectivity, but the shortest cycle time. Perhaps for prep separation, the compromise is in the middle here in blue, where you sort of have an average selectivity, but overall the cycle time is less than what you're seeing with red. So you can get more material on the column faster and load more at each individual injection. So for the sake of argument, let's just take IE as the separation that we want to move forward. This is the chromatogram that I showed you on the last slide for screening. So we need to check solubility and we need to check loading to determine the productivity. Now, under normal phase conditions, the solubility happened to be 65.2 mg per mil. So we take that concentrated sample and we begin loading more onto the column using the touching band approach, which is essentially a fancy way of saying make increasing injection volumes until the back of peak 1 touches the front of peak 2. So if we do that, as this chromatogram here shows, in blue, you've got what would be sort of an analytical injection at 5 microliters, and you begin adding more and more material. Red is 100 microliter, green is 125 microliter. And you can see here, especially in the green, that the back of peak 1 is almost touching the front of peak 2. Now, one of the, I guess you could say, important things to take into consideration when doing prep is the wavelength of detection. What is often a good analytical wavelength for detection is not usually a good wavelength for prep. And that is because the detector can become very quickly swamped by increasing the injection volume. And so you might accidentally think that you're overloading the column far before you're actually doing so. As an example of what that looks like here, this is all the same wavelength. This is all at 230 nanometers. This is the exact same series that I showed on the last slide here. This was at 365 nanometers, however. So at 230 nanometers, the green and the red injections look like you have far exceeded the loading of the column, to the fact here in green where it almost looks like it's about ready to completely co-elute. But again, this is at 230 nanometers, so the wavelength, the detector is swamped in terms of detecting the amount of material. Overlap that with that chromatogram I previously showed at 365 nanometers, that's now in red here. And you could see, again, we still have a little bit more room actually that we can load more material onto this prep separation. So if we take those separation conditions, 125 microliters, the solubility, we've got the cycle time, which is the front of peak 1 to the tail of peak 2. Plug that in this spreadsheet that we have internally, and you get a productivity calculation of roughly 67 mgs per hour. But again, we're not just doing single injections. We're going to be doing multiple injections at the same time or across a given period of time. So this productivity is inclusive of what that stacking is going to look like. And I will say too that this productivity is on the analytical column, so we will be addressing scaling this in a couple of slides from now. But stacked injections look something like this. You're going to add material in purple, the racemate, onto the column, let it begin traveling down the column to separate into its respective blue and red components. And while that slug is going down the column, you're going to make another injection and you're going to let that move down the column, and then you're going to make another injection and you're going to let that come down the column. So for some real world examples of what this looks like on Teledyne's prep system, I'm going to now switch it over to Todd for a little bit more explanation.
Thanks, Wes. I appreciate the transfer, and go get yourself a quick drink of water and take a breath. So when we look at doing stacked injections, what we like to look at is, as Wes has already mentioned, a couple of different things. The most critical thing is you're going to want to make sure that your compounds have no impurities, because when we stack them, as you saw on that previous slide, you're basically going to be putting material on the column almost constantly. And as you do that, if you have impurities anywhere within your runtime, they will actually come out probably somewhere on one of your components, one of your major enantiomers. So what you would want to do is, unless you have a slide, a separation that kind of looks like the one that you see right here, where you can actually isolate the impurity in between the two components, you're going to want to try and make sure that that's perfectly purified on the system. So we can obviously do this, but the critical importance is that we are running an isocratic method, as Wes was mentioning earlier. So as that's going isocratic, we're just going to dump material onto the column in a particular given format. And some of that calculation can be complicated, maybe not so much, but in the older days, we used to do run times when I was at Chiral, and we would do run times, subtract out your cycle time. You would have an R1, your R2s, your all these different numbers that you would go into a calculation, which can be very complex and difficult. But why don't you just let our software do it? So if we go to the next slide, you'll see that we can actually take that information, run an isocratic chromatogram. From that run, we can actually, in the lower right-hand corner, see where it says stacked injections. We can pop that up, and it will allow us to do some things that we'll see on the next page. So if we go to the next slide, there it is. So you can see within the software, we allow you to visualize 3 stacked injections, even though we only made 1 injection as a scout. So what we would typically do is run 3 or 4 runs just to make sure that we've reached a stasis between the temperature, the isocratic composition on column, and make sure that the stationary phase is completely wetted and homogeneous throughout the entire column. Once we get that stasis, then we can go ahead and isolate the individual components just by changing a couple of those values on the right-hand side of the screen. As you see, we can change your cycle time. We can change the individual peak windows. So if we wanted to collect the entire window between the 2 major isolates, we can also collect all the impurities as well, just by checking them off, as you can see there. Once we do that, we could also go back and do this and put it as a single, just go back and forth just by clicking on the single or multiple display. So after we've done this, then we'll go ahead and show what it looks like in real time. And this is what it looks like in real time. So this is a sequence of 7 injections that you can see here, where we've stacked them one after the other. And if you were to run these individual 7 injections, you're looking at probably about maybe 21 minutes of runtime. But when we stack them, we can actually do all these 7 runs at 9.5 minutes after we do all of the additions. So we basically have saved at least, half of your time of running sample. Now, the longer you run, obviously the more saving of time you get. So this is what we are really trying to focus on with SFC, is for chiral separations to actually do this stacking to save you as much time as possible. And with that, I believe I'm going to be passing this back over to Wes so that he can go ahead and, now that he's got a little breather in there, to go ahead and bring us into the end.
Yep. So let's circle back to some of those calculations I talked about, scaling from the analytical column size to preparative column size. So we chose the 5 micron 4.6 by 250 because if we've got the same column length, when we scale to prep, all it is a simple scaling factor to figure out what the productivity will be on that newly sized prep column. So the scaling factor is going to be the ratio of the column ID squared, which I have on the second line here. So for a 1 centimeter prep column, it's 1 cm squared divided by 0.46 squared, which is the analytical dimension, which gives us a scaling factor of 4.7. Now, 4.7 is the LC scaling factor. In reality, because of the low viscosity of SFC, we're generally running at 3 times the flow rate of what we can for LC. So if you take that and multiply it by 3, round it up, say to 15, your analytical method scales by 15 for SFC. So take your flow rate and scale it by 15, your injection volume, and everything else. If we do the same thing for 2 cm columns, it's 56 mils a minute, 128 mils a minute for 3 cm, and 5 cm is up to 350 mils a minute. For the sake of math, if we just scale back to what it looks like under the LC conditions, if we take the productivity calculation on analytical scale, which was 67 megs per hour, if we wanted to try to separate a kilo of material, we'd be closing in on 2 years to do that with stacked injections. Of course, if we go to a 1 cm column, we scale everything by 4.7, you're down to 132 days, which is certainly an improvement. Go to a 2 cm column, 29 days, 15 days for 3 cm, or a little over 5 days for a 5 centimeter column. So this is extremely important when it comes to moving to prep. And of course, these benefits are amplified by using SFC, as all of these would be times 3, so higher throughput. Make sure, and these are some considerations when you're running any sort of separation, that your prep system is able to handle all of the scaling that takes place. So make sure that flow rates and injection volumes can be handled by the system. Otherwise, you'll have to do some changes to flow rates when you do your method development to account for that. Larger ID columns, you're going to be generating a fair amount of solvent, certainly much less in SFC than you would be under LC conditions, but you want to make sure that you have the infrastructure to be able to handle the solvent removal. So large ID columns are producing liters of solvent a minute, making sure that you have thin film evaporators or something that can handle that volume. 5 centimeter columns and smaller, 20 liter rotovaps or even benchtop rotovaps are much more manageable in those cases. So last, we'll finish up with some column care things here. There are sort of 3 major issues that we usually face when it comes to chiral column integrity. This is really chromatography columns in general, but especially for chiral columns: pressure, peak shape, retention, and selectivity. The major one that I'm going to focus on is pressure, particularly under SFC conditions, because again, we're not able to check our solubility of our analyte in the entirety of the mobile phase. So there is a propensity at times for sample to crash out on the column, which is the major issue or the major cause for increase in pressure. So the biggest culprits are plugged inlet frit, or it is the biggest culprit, whether that is from insoluble material in the sample, seals in the pump that are wearing and generating particulate, or mobile phase incompatibility resulting in sample crashing out. Mobile phase component crashing out inside the column, not as big of an issue for SFC, but certainly under reverse phase conditions, if you're using high percentages of buffer, that salt could crash out if you're using a high percentage of organic. Same goes with bacterial growth. That's more for reverse phase. In addition to the pressure obviously increasing, there's a chance that you will begin to see peak splitting take place, something like this. You might also see it manifesting as peak tailing in the case of A as just a long tail, or in the case of B as a sort of a back end shoulder. Both of those are scenarios where you've got particulate on the inlet frit, which is resulting in a diverted flow path. That diverted flow path then is eluting later than the main slug, so you see either the tail or you see the shoulder. To prevent these issues, it's definitely a good idea to filter your samples before you inject them onto the column. So 0.5 micron or even better, 0.2 micron filter. Make sure that you are maintaining your system regularly to ensure that the seals are not wearing out too quickly or in the process of wearing out. And whenever possible, using some sort of an inline filter to catch particulate before it makes its way to the column. Mobile phase incompatibility, again, we want to make sure whenever possible we match the sample solvent and the mobile phase. So you're going to be in SFC injecting in whatever your modifier is and using something like dichloromethane if you can to bump up the solubility, assuming you're using an immobilized column so that you don't wreck your coated columns. Storage conditions can have an effect as well, especially if you're using additives and things like that. You don't really want additives to stay in the column for too long. So for SFC short term, it's okay to leave the column on the system, but make sure that you flush the column with 100% methanol or ethanol at a reduced flow rate, just to make sure that those modifier, the additive in the modifier is removed. For long-term storage, again, flushing with methanol or ethanol is a good idea before you store it. It can be stored in hexane IPA, which is a normal phase solvent, but for SFC, 100% ethanol or 100% methanol is certainly safe. Once the pressure begins to rise, unfortunately, you're kind of stuck. If there's particulate matter that's making its way onto the inlet frit, oftentimes the entire column or the inlet frit needs to be replaced. You can sometimes reverse the flow of the column, disconnecting it from the detector, of course, so that you're not also junking up the detector. Backflush the column, and sometimes you can push that insoluble material off of the inlet frit. But I will say more often than not, by the time this is noticed, the material is ground into the inlet frit, and it requires either a complete column replacement or just a frit replacement. Very quickly through the peak shape and the selectivity issues. These are often caused, again, by plugged inlet frits, but also things like voids in the packing, chemical modifications coming from sample adsorbed samples, using things like biological samples or petroleum-based samples that are not cleaned up well, or chemical attack using an incompatible additive or solvent on the column when it should not be used. You will see this manifest much like you did previously, tailing or shoulder in the front. But if it's a void in the packing, you'll see something like this, where it's a shoulder in the front this time. And this is caused by, again, not a diverted, but an unrestricted flow path through the packed bed, where you've got a slug that is able to make it through faster than the main flow, giving you this sort of front shoulder instead of the back shoulder. Voids in the packing, what are some of the things that you can do to avoid that? Obviously, making sure that you're not dropping the column or hitting it on a hard surface, making sure that you're not shocking it in that way. You want to make sure that you're operating the column at a reasonable pressure and flow rate, especially for preparative columns. On the next slide, I'll show this. You're worried about bending inlet frits by clogging the inlet frit and then ramming up the pressure or the flow rate. So operating at reasonable pressures is definitely a good thing to do. Making sure that you're properly equilibrating the column as well when you're changing conditions. If you're changing additives or you're changing modifiers, you're probably better off backing the flow rate down until things are more or less replaced and equilibrated, and then increase the flow rate, as opposed to starting right out at 128 mils a minute for a 3 centimeter column. Good sample cleanup is always something that we have to harp on. And if it's possible, dedicating specific columns to certain conditions is always kind of a nice thing to do, especially if you're using basic additives. Sometimes you're better off having 2 sets of columns to be able to do basic SFC and then acidic neutral SFC. And then again, for the absorbed samples, good sample cleanup, instituting cleanup with things like solid phase extraction cartridges or membrane filtration to make sure that you're removing cell components or those petroleum samples, the hydrocarbons that are perhaps going to stick and junk up the column. The picture that I have here is what a biological sample looks like going through a column that has not been well cleaned up. This is the head of the column that is a chiral stationary phase that should be white, and it's now dark brown. It was not a very well-performing column anymore. And then I mentioned about operating at reasonable flow rates. This is a 5 centimeter column inlet frit over on the left-hand side here. This should be a flat disc, but because the frit got clogged and then it was also operating at a very high flow rate, it ended up bending the inlet frit. And when that happens, you end up pushing it into the head of the column, forming all these voids around the edges, something like this as well throughout the middle of it. And generally, this column then is no good anymore. It needs to be replaced and repacked. So as I mentioned, replacing it, repacking it, if these issues start to take place, you can, if it's caught early enough, regenerate the column, which we have some procedures to do that. But again, oftentimes the CSP or the entire column needs to be replaced if this is not caught early enough and rectified. Regeneration basically is just taking the columns and running them through a regeneration procedure that will allow you to restore the function to the beginning or sort of the initial column performance. So here you've got 3 examples separating under normal phase conditions at initial. After a while, the effects of methyl acetate having on the selectivity, and then after regeneration, restoring the performance to what it initially looked like. Not only for loss of separation, but also for peak splitting. Regeneration can work well if you catch it early enough, backflush the column, and then regenerate it. Here is an example of IA before and after. Obviously, the column afterwards looks nice compared to what it did previously or before we did the procedure on it. Lastly, closing remarks. I did cover a lot of information in this webinar, but we have even more useful information for chiral separations on our website. So please visit us at chiraltech.com. You've got up there some method development strategies that I did not cover in this presentation, which are always helpful, not only for the polysaccharides, but some of the other columns that I didn't have a chance to talk about today. We have a searchable product index. If you go and you type in a part number or a particular selector that you're interested in, you will be given a list of all the part numbers that match it. But more importantly, at least for this presentation, you will be given all of the instruction manuals for the columns, which I highly recommend that you review before you start using them, just to make sure that you're not using something with them that you shouldn't be. We also have a YouTube page where we cover a lot of the topics today in a little bit more detail, particularly column care, as well as some other FAQ and specific product information webinars. If you are interested in doing preparative separation, but you don't have anything geared up for analytical method development, we do provide a free analytical screening service where you can send us your compound. We will do the screening for you and provide you with a report with recommendations. We also do that for preparative method development as well. We can provide you with a report. You can buy then the prep column and run it on your nice new Teledyne SFC prep system. And of course, if things scale up too much or you want a little bit of help, you've got overflow, whatever, we do have some custom separation services in-house here at Daicel as well that we can do separations for you to alleviate some of your workflow needs. And then some other services related to the prep columns. We've got column hardware replacement as well as column reconditioning. If you do find that your prep columns are no longer performing as well as they once did, we can take those columns back in-house and work on them a little bit and get you basically a brand new column for less than the cost of a new column. It allows us to take everything apart and clean everything up and put it back together for you. Last but not least, some email addresses before I pass it back to Todd. If you've got questions about chiral chromatography or this webinar, the first 2 email addresses, please feel free to reach out either to our general questions email address or to me directly, certainly as it relates to the presentation. And then, of course, if you've got questions about the prep instrument from Teledyne or even chiral chromatography, because Todd is a former colleague of ours here at Daicel, he's very knowledgeable of it. Please feel free to reach out and take care of those questions. So with that, I will pass it back over to Todd to give us an outro today. And I appreciate you taking the time to listen to me chat about chiral chromatography today.
Thanks, Wes, for that transition back to me. I appreciate it. Yeah, so everyone, we're going to go ahead and have our discussions or open up for questions and answers. Typically, as we always do, you're going to see the question and answer button at the bottom of the page. You can go ahead and click on there and type in your questions, and then we'll go ahead and answer them as best we can. We will leave this page up on the screen if you want to take our information down. We will also be recording this and putting it out onto the web later, and you'll get a notification when it's available. So you can always go back and view this at a later time as well. So with that, I'm going to go ahead and we'll start questions and answers. thank you so much for joining us, and hope to hear from you soon. So it looks like we don't have any questions right now, but we did have one earlier this morning, which was actually a pretty good question. Somebody asked why we don't do scouting with the columns in basically a gradient format, which is perfectly fine if you're doing achiral purifications. But as Wes noted earlier, if we do a gradient scout or do screening with a bunch of different gradient runs, that's great. But then once we finally get that method found on an analytical system, when you do that, to switch it over to preparative runs, it's much better to have the column completely equilibrated in the isochromatic solvent that we're going to be running, just due to the nature of the stationary phases and the time it takes typically for them to become stabilized. So is there any other questions out there? I know we ran a little bit long today, so if there's not, I'm gonna go ahead and send it back to Garrett for him to finish out the session. Oh, we didn't get one pop up. Is the stacked injections option available in the EasyPrep systems, and can the SFC module be added on an existing EasyPrep system? So the SFC is not technically a module. It is an actual full instrumentation. So the instrument actually comes with all the components that are needed to run SFC. As far as the stacking, there is discussions that once we get the SFC squared away, there's potential of bringing that over onto the AccuPrep platform, because the software between the AccuPrep and the SFC is very, very similar. So we are looking at doing it with the AccuPrep, but not so much with the EasyPrep. That's not to say we won't. We just don't have that in the immediate future.